And now we have Nigel Kendall, Associate Professor and Sub-Dean for Admissions for the School of Veterinary Medicine and Science, and Harry, who is an April entry student, to talk to us about the 3 undergraduate courses available at Nottingham. Hello.
Hello.
So, what undergraduate courses does the School of Veterinary Medicine and Science offer, and who should apply for each course?
Rather than actually being 3 courses, there's sort of one course with 3 entry points. So the course of Veterinary Medicine and Surgery is the main course is 5 years, which takes through. Then there's 2 additional courses which have an extra year. One of which is the Gateway course, which is for widening participation candidates and for a lot of our contextual offers. And then we have the preliminary course, which is for those who don't have the correct science A levels. Not those that haven't achieved the grades, those that haven't taken it.
Okay.
So it can be people who've made late decisions to do it, or it's very useful for people who've done different careers and are coming back into the vet course. And to a certain extent, just apply for one and our admissions team will put you to the correct course.
And Harry, why did you specifically choose Nottingham to do vet med?
I think one of the main things for me was being on the same campus for the whole 5 years. It meant I could sort of build a life on that one campus in the same student accommodation the whole time and sort of become part of an actual community rather than switching between different campuses.
And going on from that, could you tell me a bit more about the campus community and the kind of societies that operate within the vet school?
So the main society would be VetSoc. We have a separate VetSoc for September and April, so we can basically cater for all year round and still run events even when September's not on campus or whenever. But actually, the community it's a great feeling. Everyone knows everyone across staff and students as well. It's small enough that you can know everyone.
Brilliant, thank you so much. And you touched on the 2 different intakes in September and April.
Yeah.
Nigel, can I go back to you and ask how this 2 intake thing works?
Well, one intake comes in September and they stay and have their teaching across the autumn, have their Christmas break, then carry on up towards the sort of March or the April time, and then they finish their direct teaching. Then they go off, do their revision period, have their exams, and have time available then for holidays and to complete their extramural studies, the placements that the Royal College require them to do as part of the course across those summer periods. Meanwhile, the April cohort start in April, do their first term. They have their Christmas somewhere in the early July, so they do get 3 weeks off in Christmas in the summer, yes. Turkey on the beach, those sort of things.
We call it our Australian Christmas.
And it's exactly the same in the UK. Yeah.
So it's and then then they carry on through. The April cohort will end up having their exams November, December. Ideal for people who've got hay fever because you're not sitting in exams struggling from hay fever. So that's the thing, and then it carries on each of those years.
Yeah.
And then you got so it's just a 6-month split. The other big thing with the April cohort, it gives that mini gap year. You've got your place at university confirmed. You're going, oh, right, I haven't got to rush. Get everything ready. Go. You go, right, I can go that. I can go and work the Christmas season. I can pop skiing. I can join then, and then come April, you're in, you're studying, and then you've got the summer while you're studying.
Brilliant, thank you. And you are an April vet.
Yes.
So how's your experience been? What have been the benefits of being an April vet?
I think one of the main things for me was, as Nigel said, that mini gap year.
Yeah.
It had never even occurred to me to do a gap year. Never been on my radar, and actually, it sort of almost forced my hand to have 6 months off. And I mainly worked for that, but actually that is what I needed, a little break from education. Not long enough that I felt like I was completely out of it and couldn't do a lecture ever again, but just that little something. So that was a main advantage for me, I found, although I didn't realise it until very later on. But the other thing I would say is the EMS placements we have to do. Obviously now with so many vet schools, we actually compete in a lot for placements because everyone wants to do them at the same time in the summer holidays. We're not competing because we're actually trying to do them at a different time. So actually I've managed to get placements that have a 2-year waiting list in 5 months.
Wow.
Because there's no one there. I'm looking at a completely different time where they wouldn't normally have any students.
Brilliant, thank you. Okay, so could you talk us through some of the curriculum that you've studied on your course and what parts you've enjoyed the most and why?
I think mainly for me, I quite like the emergency critical care stuff, bit of a high pressure situation. So we cover like CPR, fluid therapy, stuff like that. But we cover everything right down to how to blood sample a tarantula.
I'm glad I don't have to do that.
It's never something I thought you sort of think dogs, cats, horses.
Yeah.
But yeah, with tarantulas, hedgehogs, all comes up. Fish.
Blood sample fish?
Yeah, and doing a full like general anaesthetic on them as well.
Wow.
It all comes up.
Okay.
You'd never heard of fish surgery before, had you?
No.
Neither had I until now.
I thought they just float to the top of the tank and that's it. Belly up. Okay, thank you. And obviously on Sutton Bonington we have some great facilities. So could you tell our prospective students a bit more about that, please, Nigel?
Yeah, we've got some really good lecture rooms, varied. We've got a big 400-seater tiered one, which is great for if we've got multiple groups and when we're doing open days and things. You'd see that if you actually come attend an open day. We've got a lot of nice sort of flat ones which we can do group work, a load of small group teaching rooms so we can break and do this problem-based learning, case-based learning. We've got clinical skills lab where where they're set up with lots of stations for dogs and ultrasound machines on those stations. A clinical skills centre which is for students to revise all those practical skills, which there's a lot of practical stuff in the course. In terms of doing the practical, we have our own small holdings, so we have cows and sheep and pigs and chickens. We've got the stables where we've got horses, and some of the horses are the students' own horses,
yes,
which can be used, so there's a livery option there as well. We've got exotics as well, so there's various snakes, bearded dragons. We've had the tarantula mentioned before, so it's behind you, by the way.
Oh. Mean.
And this is the Sir Peter Rubin Centre for Veterinary Education, which is like a mock practice setup. One of the things we actually don't have, which people can take as a negative, but is actually a positive, is we don't have a vet hospital on site. So we don't have that because vet hospitals on the universities tend to get high set referral caseload, second opinion. So you get all the weird and wonderfuls and not the day-to-day stuff that you need to see. Harry, when he graduates, needs to have day one competencies, which are set by the Royal College of Veterinary Surgeons, which tell us what they need to learn. So by having them going out into a community-based model where we work with lots of vet practices, where our students go out. One of the practices, the students actually run a part of the practice. So they run reception, they're the vet nurses, they're the practice manager, and it's a really great experience for them.
Yeah, great experience. Thank you. So my last question, and I'm going to ask both of you, is what's your favourite thing about the vet school at the University of Nottingham?
I think to me, sometimes it's the students, the interaction with the students, how well the students communicate. We like students that can communicate, can interact, because to be honest, the veterinary profession is a people profession, not just an animal profession.
I think for me, it has to be the community at Sutton Bonington. It is something that I've never experienced anywhere else. Not even just through the med school, but with bioscience as well. We're all one big happy community down there, and it's a great feeling to be a part of.
So obviously veterinary medicine can be quite an intense course. What kind of student support is available to you throughout your time here?
There's obviously certain things in the vet school that Nigel will pick up in a minute, but from a VetSoc perspective, we have two main things. So we run the Big Vet Little Vet scheme, which is essentially where we get second years to apply, and we match a second year with a fresher. So they've always got that person that's been through the first year already to sort of look to for anything really, guidance, notes if they've missed a lecture, so they can sort of make of it what they want. There's no pressure there. Throughout the year we'll run a couple of socials like a hog roast to get them to know each other and make friends, but they can make of it what they want, and they're always there to ask questions. And then we actually every year, along with some of the vet school staff, run a mental health first aider training session. So we're looking to train 12 to 16 students every year.
Brilliant.
It works at about £10 a student, and that is what they...
And that's a great string to add to their bow as well. Yeah, brilliant.
The more people we can get trained, the more people it's going to help look after throughout the vet profession, not just at the vet school.
Of course, yeah, perfect. Thank you. Do you have anything to add to that, Nigel?
Yeah, there's plenty of other support within the vet school. We've got the personal tutor system. I've got about five tutees in each year. I do the September cohort, so we split the cohorts there.
Yeah.
So you're either a September tutor or an April tutor, but you have all 5 years. So you've got that vertical integration that they can talk to each other. My tutor group actually takes all ones that have been in the preliminary gateway courses. So I've all of mine have got that commonality.
Lovely.
Within that, we've got a senior tutor team who split into looking after welfare and those professionalisms who will do the, it's a professional degree. So there is the element of you need to be fit to practice when you graduate. So there's a certain element of fit to study, and there is the professionalism team which will give the odd slap on the wrist. So we've got that. We've got a whole welfare team as well, which will look after welfare. We've got our disability liaison officers. We've got the front desk to look at a lot of the student experience and look after that and run extra little things. I think they've run a bingo thing recently, and they'll do extra little events for the students. There's as well. This is in addition to there will be the university counselling service and the university-led facilities, as well as those that are based within the vet school.
It sounds like you're all pretty well looked after then.
Yeah,
Definitely.
And even things like booking placements. There's a whole placement team that help the students book the placements, have a big database, and have all the feedback of previous students that have been on those placements.
Thank you both so much for coming today. There's lots more to view on the website about veterinary medicine, and don't forget to keep those questions coming.